Hi folks, Jess and Al from the Psych Collective, and today we're talking about anhedonia. So, what's that mean? What's anhedonia?
So the way, from my training,
Yeah.
the word it takes its root from the words hedonism, which means to do things for pleasure, and the prefix of a means no pleasure. But so my training says this word means loss of interest or pleasure in activities previously found enjoyable.
Yes, loss of interest and pleasure.
Yeah.
They're two different things. So we've got one word that covers two different things. And I'd actually argue that it's probably really covering three different things.
Yes. So where we come into problem is this word being used with double barrel meaning that doesn't actually facilitate skillful intervention.
Yeah.
So we've split it. We've recognised that this is probably actually the concept of loss of interest or pleasure actually covers three different things. And there's two words here that you probably haven't heard before, and we don't use them very often in clinical settings. Avolition, define that one.
Okay, so avolition is the loss of motivation. Okay, you lose your mojo for the thing that you want to do.
Yeah,
okay.
So I see the word kind of volition as the root, meaning almost kind of like willingness.
Yeah.
So I'm not willing to do the thing that I need to do
or
or want to do.
Want to.
Yes.
I don't want to do it.
Yes.
Okay.
Anergia.
Yeah, is the lack of energy. I just don't have the power. I'm too fatigued. I just can't be stuffed.
Yes, and you can see kind of energy kind of inherent within the word.
Yeah, yeah. So a lot of the time when people have what's referred to as anhedonia, they may well have the lack of motivation, okay, or the lack of energy.
And this is an important distinction to get right, because when we misuse words, we then also run the risk of kind of applying the incorrect intervention here, because the strategy that I know at least I was trained on for anhedonia is behavioural activation and activity scheduling. I know you don't really feel like doing it, you're not really interested, but go and do it anyway.
Yeah, because the idea with behavioural activation is you don't feel like doing it. However, if you do it, you will experience some positive emotion, and that will kind of offset some of the negative emotion. Okay, so if you don't feel like doing it is avolition, or I don't have the energy to do it. If I do it, yeah, I kind of enjoy it, anergia. What anhedonia is, you do it, somehow you get it done, and you just do not enjoy it. Okay, your mood does not rise to the occasion.
Yeah.
So anhedonia, true anhedonia, in that I have zero enjoyment in this thing, doesn't seem to respond to behavioural interventions such as behavioural activation. But avolition and anergia do respond to behavioural activation.
Yeah, so this comes down to if you actually understand what you're dealing with, then you're going to kind of be able to do a better kind of match up of skills.
Yeah, you want to untangle, you really want to untangle true anhedonia from broad anhedonia, which is all of these things, okay? So if there is, okay, it's avolition, it's anergia, but my mood rises to the occasion, behavioural activation.
Absolutely.
Scheduling, routine. Enlist people to help you activate the behaviour.
Yes.
All right? So this is very responsive to behavioural and psychological interventions.
Yes.
Okay? But true anhedonia, where you do the thing, your mood doesn't, in fact it's torture. Not only does your mood not rise to the occasion, but it's just negative emotion. Behavioural activation, you're just going to throw yourself into a situation of more negative emotion.
Yeah, and you've taught me that we would usually only see true anhedonia in melancholic depression.
Look, I think so. I mean, I suspect you can probably get it fleetingly in all kinds of states.
Yeah.
Okay. But in melancholic depression, that's kind of, that's part of the course.
The core feature.
Yeah. So this is where I think you're limited to so psychological interventions work well here. Psychiatric interventions are needed here. And that's basically medications, whether it's antidepressants like serotonergic antidepressants or noradrenergic antidepressants, which may well be required. Other things like ECT and TMS, okay, they can probably move the needle on anhedonia as well.
Right.
Yeah.
So take home message from this, the term anhedonia is probably being overused, right?
It's being used in a low resolution way.
Okay.
Yeah.
Okay.
So this is a higher resolution way of thinking of it.
So then if what you're actually experiencing is I can't be bothered or I can't muster enough energy to go and do it, then we use behavioural activation and activity scheduling to, even though you don't feel like doing it, go and get it done anyway because you're going to feel better for it afterwards. That's these two,
yeah,
but not this.
Yeah.
So we've developed a handout that we're referring to as BASIC, behavioral activation. So basic, and we talk about this of if what you're trying to do is just kind of propel yourself into some sort of activity, keep it basic. Body care, achievement, interest or socialization, interests, and clean. Right, so we've got a handout from this. You can download it from the resources page off our website that will help primarily target these two if that's what you're actually dealing with. But for our kind of philosophy for Psych Collective, we want you to have a greater, higher resolution understanding of psychological kind of concepts and themes and skills. So if this is what you're working with, behavioral activation, go check out our handout.
Yeah. Anhedonia, too low resolution. What's happening in all of these three factors?
Okay.
Yeah. Okay, good.
Thanks
a lot,
guys.
guys.